that comes off the top of his head, and it may not matter very much at all tomorrow.
John, the president is slamming the World Health Organization tonight, saying that they missed the pandemic. But in late February, he was praising their coronavirus work. I mean, what is this scapegoating all about?
Well, remember, he was praising its work at a time when he was trying to make the point that this wasn't a big threat to the United States. So praising the World Health Organization at that time suited his objective, which is to tell people it wasn't a big deal and not disturb the markets and have a calmer situation in the country. Now that all hell has broken loose, the country has shut down, he's looking for somebody to blame. And he's been in a full-scale blame game for a couple of weeks now. Democrats, the media, governors, hospital workers, the WHO. And again, it is true, as you said at the top, the WHO was slow on this, but not as slow as the United States. And the United States being slow, in part because they did not accept the WHO testing technology, which South Korea did and exploited it successfully to avoid shutdowns. That's one of the reasons that we're in the situation we're in.
Yeah. Daniel, Trump also tried to rewrite history when asked about comparing coronavirus to the flu. Take a listen to this.
You say this week will be very painful, very difficult, but a few weeks ago you say this was just like a flu. What have you learned?
I didn't say 2 weeks ago it was a flu.
The question is, Mr. President, what have you learned that you could offer as an advice to foreign leaders who still are skeptical about this pandemic and who are against social distancing? What is your advice? What have you learned?
You said I said it was just like a flu. So the worst pandemic we ever had in this world was a flu, and it was called, you know that, it was in 1917, 1918, and anywhere from 50 to 100 million people died. That was a flu, okay? So you could say that I said it was a flu, or you could say the flu is nothing to sneeze at.
Daniel, what's the fact check?
So the president here, Don, is trying to have us believe that all those times that he likened the coronavirus to the flu, he was not downplaying the coronavirus. He was warning us that it could be a pandemic as bad as what happened in 1918 and 1919. That was the president's suggestion. That's just complete nonsense. The president used the phrase regular flu. He used the phrase common flu. He kept invoking the tens of thousands of deaths that happened in a conventional flu season like this year or last. And as he was doing that, he kept generally downplaying the state of the outbreak in the U.S., saying, you know, we're going down to zero, it's going to go away, et cetera, et cetera. So this is just, as you said, complete revisionism. It's abjectly, completely false.
All right, Daniel. Thank you. John, thank you. I appreciate it as well. Now I want to bring in Dr. James Phillips. He's a physician and assistant professor at George Washington University Hospital. Thank you, doctor. Appreciate you joining us once again. So in New York, we're told hospital and ICU admissions are down over the last couple of days. You're on the front lines in Washington, D.C. What is it like there? Where are you in this fight?
Yeah, it's a great question because different places around the country have been seeing different levels of patients. Obviously, New York has been hit the hardest. We're seeing New Orleans, Detroit, some other areas. But what's been interesting in a lot of the parts of the country is that we have been building our surge capacity in a way that we've reduced elective surgeries and expanded our spaces. We've also gotten the message out well about trying to avoid coming to the hospital unless you have a real serious need. So in Washington, D.C., and some other, actually a lot of places around the country, we've seen our daily census actually drop. Sometimes physicians are actually being told, you know, come in a couple of hours late because we don't quite need you right now. And there's a reason for that. I think it's because patients are getting a message that says if it's not really serious, you should probably stay home. Mm-hmm. Our concern is that people are staying home I have two concerns there. One is that they're staying home because they may be afraid they're going to get sick at the hospital. And I want them to feel that we're doing our best to protect them from getting an infection in the hospital. So if you're sick, please don't stay home. Still come see us. And then the other thing is that I think people are afraid of going out in general. They're hearing this mixed messaging about masks, and in urban areas like where we live, transportation is an issue, and so people are afraid to take subways and even just to walk out on the sidewalks. So it's interesting. I've heard someone compare it to when a tidal wave is coming, the first thing you see is the water goes away from the shore before the big wave comes. I don't particularly like that because I don't like the way it makes me feel, but I'm afraid that it might be the truth.
All right, doctor, thank you very much. I appreciate your time. Tonight, as the number of confirmed cases of coronavirus in the United States climbs up near 400,000, there may be a slight glimmer of hope in the battle against the pandemic. Here's CNN's Erica Hill.
With about 97% of the country now under stay-at-home orders, new evidence it may be working.
The numbers are going to be much, 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 much lower than would have been predicted by the models.
The director of the CDC saying the U.S. death toll could be far lower than previous projections of 200,000, thanks to widespread social distancing, which models had initially estimated just 50% of the American public would follow. The reality today is much higher, though officials caution this is no time to ease up. On Monday, New York logging the state's largest single-day death toll. One overwhelmed funeral home doing its best to meet the need.
We're no longer embalming them.
Why is that?
Just because we don't have time to have visitations. We're simply either burying directly or direct cremation.
Healthcare workers continuing to sound the alarm about personal protective equipment. In Maryland, one nurse practitioner tried making a face shield out of a page protector and a headband.
I put it on and I started crying. And I thought, I can't imagine anybody wearing something like that.
Staff also a major concern. Retired nurses and doctors answering the call to help relieve those on the front lines.
I've never seen emergency departments or nursing or any of the services actually in general under so much threat. And, it's a family. So when family is threatened, you try to step up as much as you can.
On board the Comfort, which will now be dedicated to COVID patients, the number of beds cut in half to 500 for safety. One crew member has tested positive. Meantime, in Florida, this tightly packed line for unemployment forms, a sobering picture of the growing need.
Everybody out here is risking their lives to get this application.
We've given out hundreds and hundreds of applications.
In Connecticut, unemployment applications are about 20 times higher than anything the state's seen during a recession. Wisconsin voters on Tuesday trying to keep their distance at the polls, as one of the nation's largest grocery chains announces new restrictions on capacity amid concerns about how and where the virus is spreading. In Miami Beach, face coverings now required for all customers and employees at grocery stores, pharmacies, and restaurants, including those making deliveries. Don, there's been a real focus too on first responders, the needs that they have as they are answering these calls. We know that the NYPD on Tuesday, some 20% called out sick. That's 7,600 uniformed members. Of course, they are not all calling out sick for coronavirus. But what we can tell you is that the NYPD did also announce its 13th coronavirus-related death today.
Erica Hill, thank you so much. The Surgeon General says while everyone is susceptible to the coronavirus, African Americans are at higher risks. We'll tell you the facts behind the reason why next.